Hey everyone, this is Libertarian Black Man. We should abolish medical licensing laws. That sounds crazy to most people, but actually it would be the best thing for our country because these laws stifle competition and innovation in the medical sector, and they raise the cost of medicine. So what I found was a document published by Ronald Hamry, a PhD in sociology and a professor at the University of Alberta. And the document titled Early Development of Medical Licensing Laws in the United States from 1875 to 1900 shows us really what happened during the 19th century regarding medicine. You can divide the century up into three periods. The early period, when we had licensing laws, the middle period, when they were gone, repealed, and the late period, when they start coming back. So during the middle part of the century, medicine was unlicensed, and anyone who had the inclination to set themselves up as a physician could do so. And the market alone would determine who was successful and who was not in the field of medicine. And by not having laws requiring licensing, it was easy to get into the medical sector, and medical schools abounded, the great bulk of which were privately owned and operated. And many people who wanted to practice medicine found it easy to get in. This ended up resulting in the proliferation of medical schools and doctors and medicine in total. In 1860, our census shows that we had 175 physicians per 100,000 people in the country. This was the highest number of doctors per capita of any nation in the world. We were proliferating medical care because we did not have the types of licensing laws that we had in the early part of the century, during the mid part of the century. We had competition, which led to the proliferation of not just more medicine, but better medicine. And we had heterodox theories, which mean unorthodox theories, competing with orthodox theories. What was orthodox medicine back in the early 19th century was treating people using bloodletting, blistering, and administration of massive doses of compounds of mercury, antimony, and mineral poisons. Even arsenic was used as medicine. Now today, even people who are not familiar with medicine know that mercury and arsenic are toxic, and you shouldn't go anywhere near them, or certainly not have them put into your body. But this was established medicine in the early part of the century and protected by licensing laws against competition. As a result, we had lots of people who were dying because they were being treated by their doctors. People who were trained to save them, help them, were killing them unintentionally, but that was what was going on with medicine. People just did not have the knowledge of what they were doing to people. Then we see in the early part of the century the introduction of competing philosophies, eclecticism and homeopathy, two forms of medicine that come in and actually get the repeal of licensing laws that we had in the early part of the century. During the colonial period and the earliest years of the Republic, we had laws that protected the people who said bloodletting and arsenic were good medicine. And then these eclecticism and homeopathy come in and say that stuff is terrible. And actually, the way we should treat people is a much different way. And eclecticism was founded by Samuel Thompson, who was a farmer. And he pioneered eclecticism based on botanical remedies and steam baths and rest. So herbs and vegetation and steam baths and not taking time out of work to rest was one form of medicine that was beginning to compete with orthodox medicine of that time. And he said that the type of medicine which was called heroic medicine, I'm not sure why it was called heroic, but established medicine using blistering, bleeding, and mineral poisons were instruments of death. And today that's common knowledge. Arsenic is bad for you. Mercury is bad for you. that's common knowledge today, but that was seen as good medicine by trained, established doctors back in the early 19th century and before. And then also, what physicians back then who believed in mineral poisons as good medicine also believed is that if you have a medicine, the more you give someone, the better it will be for them. The higher the strength of the medicine, the much more effective it will be at taking care of somebody's illness. So regular physicians prided themselves on the strength and quantity of medication administered, many believing that if 10 grains of a substance were thought to be beneficial, 100 would prove 10 times more effective. Now, anyone who's ever heard of Botox knows that Botox comes from botulinum, which is one of the most toxic substances in the world. And the reason why a person who is given Botox doesn't die is because the botulinum has been diluted so much that it does very little to the body except get rid of wrinkles and stop migraines and muscle spasms, because the toxin does something. It paralyzes muscles, and it does other things that if at full strength would kill you, but diluted down many times would actually just it would provide a much less harmful effect, but do other good things for you. So what eclecticism said is that, and homeopathy said, is that minute doses were far preferable to stronger ones, and therefore you had less of a chance of killing somebody by using a medicine if you had diluted it instead of making it to where it was so strong that it would kill someone. Now, homeopathic physicians were strong proponents of fresh air, sunshine, bed rest, proper diet, and personal hygiene for recuperation in an age when regular medicine regarded these as little of no value. So things that make sense to us: fresh air, sunshine, bed rest, proper diet, personal hygiene. Today, everybody says this is good for you, this is what we should be doing, and that it's good for health. Medicine that was established orthodox medicine during the early 19th century said this is ridiculous, that this does not help treat someone, that in fact we need them to have mercury and arsenic and bloodletting as ways of curing them of some illness that they have or some kind of disease they might have. But what happened was homeopathy and eclecticism had established themselves as competing systems of medicine. And in certain areas, homeopathy was popular in urban areas, and eclecticism was more popular in rural areas because it relied on botanical and herbal remedies, which was plentiful out in the open country. So we have these forms of medicines competing up against established medicine, which actually said that homeopathy and eclecticism were pure quackery. Established medicine said these guys don't know what they're talking about, and yet the public began to pay more and more for treatment by homeopathic and eclectic doctors, who were again seen as unorthodox new doctors with new ideas that were working. People were paying more and more for them, and as a result we had a market that was growing for these types of treatments. Without these doctors, we would have been stuck with the established form of medicine. Again, arsenic is good for you, right? That's what they thought back then. Today, everybody knows that's not true, but that was established medicine, and without competition, who knows, we might still be practicing that type of medicine to this day, and I'm so glad that we are not doing so. But here is where the licensing laws come in. Regular physicians, which were the unorthodox mercury arsenic people, said that we need to organize because we have competition coming on and it's taking away our market share. So what happened was they began to enlist the support of government as a means of regulating the number and qualifications of physicians. The aims of orthodox medicine and its most effective tireless spokesperson, the American Medical Association, was threefold. Number one, establish medical licensing laws in states to restrict entry into the profession and thus secure a more stable economic climate for physicians than that which were attained under uninhibited competition. Number two, the destruction of proprietary medical school and its replacement with fewer nonprofit institutions of learning, providing extensive and thorough training in medicine with a longer required period of study to a smaller and more select student body. And number three, elimination of heterodox medical sects as unwelcome and competitive forces within the profession. So the American Medical Association comes in and says, and is made up of orthodox doctors, comes in and says, the people who say bed rest and herbal remedies and sunshine and fresh air and proper diet are quacks, and they don't know what they're doing, even though the public is supporting them and paying for their services more and more, and investment is pouring into the unorthodox doctors who are coming in with good medicine. The orthodox doctors who are practicing bad medicine, again, mercury and arsenic are good for you, bloodlettering and blistering are good ways of practicing medicine. These people make up the American Medical Association during the 19th century. And they come in and they try to get medical licensing laws passed to protect their form of medicine against these other people who say that herbal remedies and bed rest and exercise are good for you. And so we see a proliferation starting in the 1870s of different types of regulations, registration laws, examining boards, examinations being made mandatory, diplomas, and substandard schools and colleges are now being excluded from producing people who are eligible for licensing. Preliminary education requirements and codes of ethics. In other words, we start seeing different layers of regulations start to come in all the states, starting in the 1870s. By the 1940s, every single state is regulated through multiple layers of medical rules and regulations that restrict the number of people from coming into the profession, all the way from Alabama to Wyoming, starting in the 1870s all the way through the 1930s. Different multiple layers of regulation are being added on. And the reason is because licensing laws mandating an examination were clearly not sufficiently restrictive to severely limit the numbers of new physicians entering the profession, even when these laws also required a diploma in medicine. So the answer was to lie in statutes where both required a diploma and, in addition, empowered the state examining boards to exclude graduates of substandard colleges from consideration for licensure. So the reason we had multiple layers, not just registration laws, but examining boards, diplomas, and then schools or select schools to be considered good for medical, for those who've graduated to get licensed, is because in the beginning, licensing laws actually were not keeping enough people out of the medical profession. And as a result, more laws were coming in to protect what was established medicine. Back in the early 19th century, the American Medical Association produced laws by lobbying the government for regulations that protected the kind of medicine that was killing people. And as a result, they now get to determine who comes into the medical profession and who doesn't. Ultimately, the point is to restrict how many people come in so that the doctors can get paid more and they can practice medicine that they deemed the right type of medicine. So licensing laws, all they do is hurt people. They hurt the ability of people to get affordable medicine by raising the costs, by reducing the number of employees in the sector. And they end up protecting forms of medicine that do more harm than good at the very worst. At the very least, they stifle innovation and make it to where medicine cannot improve beyond where it was. So we should abolish these laws immediately. Thanks for watching. Please subscribe to the YouTube channel and Twitter page Libertarian Black Man, and we'll see you in the next video.